As Irene said, I'm Lisa Eickel. I am a 136 family educator, specifically for families that get that CMV diagnosis at birth, thanks to Virginia's new law about mandatory screening for infants that fail their newborn hearing screening. And I'm also a volunteer with the National CMV Foundation. So kind of through both of those roles, I'm getting to connect with families who are really needing support. And it's been a wild ride. So kind of through this presentation, we're going to teach you and you guys will be able to describe how CMV is transmitted, how a CMV infection can be prevented. You're going to learn how all women of childbearing age should receive education about CMV and what that should sound like, potential interventions for pregnant women and infants, and the requirements of the Virginia CMV law that passed in 2020. So a little bit about me first. In 2010, I graduated with my master's degree in speech language pathology. And I had a few different roles while I was practicing early interventionist here in Virginia. I worked at a charter school in Washington, D.C. I did some private practice work in Northern Virginia. And my last role was with Fairfax County Public Schools as a speech language pathologist working in the special education and autism preschool programs and elementary schools. In 2017, I had a son who was born with congenital CMV, but the Virginia CMV law did not pass until 2020. And as I mentioned, I've been a community alliance chair for the foundation since 2020 and a 136 navigator just since early this year. So we're going to first talk about Owen. Owen is my son, and that's a semi-recent picture of him. He was a planned second pregnancy. My firstborn was a toddler. He was in daycare. And as I mentioned, I worked with special needs preschoolers and elementary school children. I got diagnosed with a primary CMV infection when I was 8 weeks pregnant. So after my first OB visit, I got a call from the nurse that said, you've tested positive for a CMV infection. And, I don't really know much about that, but when you come back in for your next visit, your OB will talk more about that with you. So immediately kind of go into panic mode, start Googling, just finding all sorts of information that made us really spiral into worry and fear. I became a patient at the high-risk OB at Inova Fairfax. And through multiple scans, monitoring, extra appointments, we were always told that our baby showed no signs in utero of CMV. At the time, we were also told that the only thing that we had to worry about for him was hearing loss, since you can't identify hearing loss on an ultrasound. We really were poorly educated on the other side effects and things that could happen when a baby is exposed to CMV in utero. So Owen was born with CMV or cytomegalovirus circulating in his blood, in his urine, and his saliva, and his cerebral spinal fluid. So it was present everywhere. His symptoms at birth included intracranial calcifications. He had white matter changes in his brain, small birth weight. He was very quickly labeled failure to thrive, and he failed his newborn hearing screening in the hospital. He began treatment with valganciclovir, which is an antiviral drug, and he took it twice daily for 6 months. Follow-ups for him included hearing, vision, neurology, gastroenterology for his liver, infectious disease. We joined early intervention very quickly and started PT, OT, speech, and feeding. Currently, he's 5. He has an ADHD diagnosis as well as oppositional defiant disorder, developmental disabilities, sensory sensitivities. He recently got a failure to thrive diagnosis back, as well as labeled with anorexia and a feeding disorder. And he was just identified last month with late onset hearing loss unilaterally. So he's had a long road. I'm going to talk a little bit about what cytomegalovirus, or CMV, is. It is a double-stranded DNA virus that is a part of the herpes family. Most infections are silent. You wouldn't necessarily have significant symptoms that would even lead you to call your doctor. It is extremely common. Between 50 and 80% of adults have been exposed to CMV by the time they're 40, and up to 80% of healthy toddlers, healthy children, are shedding the virus at any given time. So if you walk into a daycare or a preschool, it is literally a hotbed for CMV transmission. When an expectant mother catches CMV, the virus can cross through the placenta and infect the developing baby. And when a baby is infected with CMV before birth, that's when that label of congenital CMV comes into play. By the numbers, 1 in 200 infants is born with congenital CMV, and 1 in 5 of these infants will have a birth defect or permanent health condition. CMV is the most common infectious cause of birth defects, and it is the leading cause of non-genetic hearing loss. Through casual contact, your risk of transmission is very small. You are not typically going to catch CMV in the checkout line at the grocery store or at the park. It is mainly transmitted through urine and saliva. So if you are an expectant mother or of childbearing age and thinking about becoming pregnant, and you have another child at home and you're changing diapers, helping them wipe their nose, they drink out of your cup. Those are ways that CMV is transmitted. And those are often things that parents do. They let their child drink from their cup when they are in between meals, or their child just grabs their cup and takes a sip. So the most common cause of transmission to a pregnant mother is from a child under 3 years old. 1 in 3 women who are infected during their pregnancy will pass CMV on to their developing baby. I forgot to mention, if anyone has questions as we go, please put them in the chat, and we will try to allow time at the end to answer any questions. So here's a little bit about the impact of CMV. As I mentioned, 1 in 200 babies are born, which is about 20,000 babies a year who are CMV positive. 90% of those babies are asymptomatic, which means they are showing no signs at birth that lead anyone to believe that they are CMV positive. But more than 90% of infants that have symptomatic CMV are not identified until later on. 1 in 5 of every baby born will have a permanent health condition. It may show up months or even years later. And so that leads to 4,000 birth defects or permanent health conditions per year that can be attributed to CMV. And recent research indicates that nearly half of children with asymptomatic CMV will end up with vestibular, gaze, or balance disorders. And we know that a lot with our balance and vestibular system is connected with our ears, which makes sense when CMV attacks that organ of hearing, that we're going to see that as an impact for these children. And Black and multiracial infants are at an increased risk of CMV. Some studies have even reported that Black infants have an infection rate that is twice as high compared to the rest of the infant population, which is extremely concerning and alarming that there is such a lack of education and information about CMV. We're not reaching enough families, and that information is just not getting out there. So this is a visual to kind of show you that there is a spectrum for CMV babies. They, on the most severe side, you could have a miscarriage or stillbirth. Some of the babies also have cerebral palsy, seizures, failure to thrive, hearing loss. Into the moderate range, we would see multiple impairments, maybe 2 or 3, like a vision loss or hearing loss with cerebral palsy. Into developmental delays, feeding and sleep disorders, hearing loss, cochlear implants, communication and learning issues, all the way to mild or asymptomatic babies, which are going to have no visible delays or impairments at birth. And this is part of what doctors will use to discuss any kind of treatment for families who have a baby with congenital CMV. So what is the economic impact for this? The estimated cost in the 1990s in the United States alone was $1.9 billion a year for families that had a baby with CMV. And the estimated average cost per child in the US is $300,000 a year to care for these children. Privately insured children with recognized symptomatic CMV, so those ones with the more severe impacts, have 4-year expenditures for their healthcare that are more than 20 times as great as other privately insured children without the diagnosis. Some of these costs are coming from medications, hospitalizations, therapy, doctor's visits, necessary adaptive equipment, hearing aids or cochlear implants, surgeries, and special education support. This visual always strikes me as I just can't wrap my mind around it. But these are 3 of the biggest viral causes of congenital health conditions. I'm sure many of you have heard of Zika. And if you look on here, it talks about how it can be transmitted to pregnant women from their unborn baby, and it can cause microcephaly, so a small head and small brain. There's no treatment available. But when we look at the bottom, live-born infants with birth defects that have been attributed to Zika is 203, and that is through the US and the US territories. Next, we have rubella. It can be transmitted from a pregnant woman to her unborn baby. It can cause hearing loss, vision loss, and also microcephaly. There is a vaccine available, and many people are able to access that vaccine who want it. Live-born infants now who are born with birth defects due to rubella is 0.75, so less than 1 a year. And on the end here, we have cytomegalovirus. So it's transmitted from pregnant woman to unborn baby. It can cause all of these birth defects that we've already discussed: hearing loss, cerebral palsy, seizures, microcephaly. There is no vaccine to date available. And live-born infants with birth defects due to CMV is between 8,000 and 10,000 in the US every year. And those numbers are according to the CDC. So it is much more widespread, but much less talked about. And we're going to talk a little bit about why. Here is a visual that compares the awareness of these commonly known viruses to the incidence. So if you look down here, something like Down syndrome, along the top, it has the number of babies born with that condition each year, and that's the dots. So for Down syndrome, about 6,000 babies a year. And then the blue bars show the percentage of women who have heard of this condition, have heard of Down syndrome. So for Down syndrome, the awareness matches the incidence. People are well aware of it, and it does occur frequently. If you look at the top for congenital CMV, the incidence is around 6,000 births each year, but the awareness is less than 25% of women. So just a stark contrast when you look at, these are 2 of the most frequently occurring birth defects, and congenital CMV has the lowest awareness level. So why is this attention to CMV so low? Why is it considered a silent global burden? Partly because maternal and newborn infections are usually asymptomatic. Like we mentioned at the beginning, the majority of babies who are positive for CMV will not show symptoms right away. So because their identification is usually delayed, once those symptoms are visible, you cannot test them for congenital CMV. Congenital CMV testing must be done within the first 21 days of birth. Otherwise, they can't attribute the congenital part to it. It's hard to determine, did the baby pick up CMV from their sibling once they got home, or from a childcare facility, things like that. But the saddest part to me is that there's this false belief that congenitally affected children, if they're born to a mom who has antibodies, they're going to be fine. And that's not true. That's a really false belief that women who have pre-existing antibodies can still have a child born with congenital CMV who is symptomatic and infected. 2 out of 3 infants with congenital CMV are born to mothers who have the presence of the CMV virus in their blood, which means they have the antibodies before they conceive that baby. So that's a really big difference to what people thought even a few years ago. They thought if you've had a CMV infection, you have the antibodies, your baby's not going to be able to get congenital CMV. So prevention, according to the CDC, pregnant women may be able to lessen their risk of acquiring CMV during pregnancy, but prevention measures have been hindered by the sense that CMV is unavoidable and it's going to stress pregnant women out and make their anxiety raised by adding this to their plate. I remember when I was pregnant being given a list of things, not to do. Don't eat sushi, don't go to Subway. If you have a cat, don't change the litter box, like have your spouse or partner do that. And nothing on there talked about don't let your toddler drink out of your cup. Don't put your toddler's pacifier in your mouth to clean it off if it falls on the floor when you're out in public. To me, those hygienic measures would not be that difficult to tell pregnant women about and say that it's, because of CMV. So there's been several studies that indicate that these hygienic measures can reduce the conversion of CMV from the mom to the baby with no adverse effects. A few states have laws mandating pregnant women be provided with CMV prevention educational materials. And the American College of Obstetrics and Gynecology said that these prevention measures and education was actually impractical and burdensome in 2015. But on the flip side, prenatal education is recommended by the Royal Australian and New Zealand College of Obstetrics and Gynecology and the Society of Obstetrics and Gynecology in Canada. And their research has shown that there is a high rating that giving this educational material to pregnant women translates into less infections. So these are the 5 simple tips to how to prevent CMV. Avoid contact with saliva when kissing a child. So if you know you are attempting to conceive or you are pregnant, kissing your toddler, nieces and nephews on the forehead, on the cheek, not putting that pacifier in your mouth, not sharing food, drinks, or even like forks and spoons. So you take a bite, I take a bite to encourage your toddler to eat, not anymore. Never sharing toothbrushes. And washing your hands after diaper changes. So not just poopy diaper changes, but also urine diaper changes, since urine is a main way that CMV can be transmitted. We're going to talk, a little bit about vaccine development. So immunity reduces the incidence of the transmission of CMV to the fetus and the severity, but it doesn't stop it. It doesn't stop the transmission. For over 30 years, several pharmaceutical companies have been working to develop vaccines, and they have developed some that have shown success in the clinic, or in the lab. But once they try to get them into clinical populations, these vaccines have not been successful. The Institute of Medicine gave development of a CMV vaccine a rating of the highest priority, but we still haven't gotten that vaccine yet. But it was the most cost-effective vaccine in development prior to COVID, meaning that the money and energy that was going into developing a CMV vaccine was going to lead to such a positive outcome due to the number of babies that are affected each year, that 6,000 number, that the cost effectiveness was worth it. Currently, Moderna is in a phase 3 of an mRNA vaccine trial. So a similar technology to what they've used for the COVID vaccine. And that was in the works well before COVID. And they are recruiting for that phase 3 all over the globe. It is actively going on. Kind of locally for Virginia, the closest sites, if anyone is interested in participating in that, is Rockville, Maryland, and Norfolk, Virginia. You do have to be of childbearing age. You do have to have exposure. I think it's 8 hours a week to a child under the age of 3. So there are some criteria. You have to be healthy, and you will not know if you get the placebo or the vaccine. And you obviously have to agree to be followed by them and have some doctor's appointments and follow-ups. So treatment, there are experimental treatments that are being offered in some states at certain medical facilities. And that is oral valganciclovir, so an oral form of an antiviral drug to help prevent a mom who's been identified with high levels of CMV transmitting that to her fetus. After birth, like I mentioned earlier, that diagnosis must be within the first 21 days of life. And if that's not, that closes the door for that baby and that family to make the decision about potential treatment with antiviral drugs. It is a 6-month regimen. It is IV or oral, depending on if the child is currently in the hospital or not, or able to take oral medication. And because of that, the babies need consistent monitoring from an infectious disease specialist, and they need frequent blood work. So blood draws 1 to 2 times a week, and that's measuring their white blood cell counts. These antiviral drugs can really suppress their ability to fight off other infections or even just common colds. And so for many families that have a baby with congenital CMV who choose to do the antiviral treatments, their babies don't get to go back into daycare, or older siblings don't get to go into preschool in order to help protect that baby while they're on that drug regimen from getting even sicker. This is just a visual that kind of shows what a typical family experience with trying to get that diagnosis of congenital CMV is like. Some of those families end up with a miscarriage or stillbirth, and they might find out after the baby has passed after some testing. Some find out in the neonatal period. Some find out in pregnancy. Some find out after that neonatal period, but the majority never receive a congenital CMV diagnosis. And I'm going to tell you a little bit about why. But this is a visual that talks about kind of what that typical family experience can be. You know, it's a diagnostic odyssey. You're testing for gene mutations and things that might have led to your child's hearing loss. You are having some of your concerns maybe dismissed by the medical community. Your child is just needing more time, do more feeds, wake your child up more frequently in the middle of the night to help them grow. You may feel let down, loss of a dream. Why didn't anyone tell me about this? Very uncertain for your child's future, frustrated by a lack of awareness and even knowledge within the medical community. Many CMV families will talk about how they often have to explain CMV to their medical providers. So even in a medical world, some of those doctors and nurses aren't getting enough information about CMV in their training to be able to adequately support families down this road. And a big portion of the families feel angry and resentful about missed opportunities for prevention and that early diagnosis and treatment. And that goes back to that need to be identified within the first 21 days of life. So this is a sweet little girl named Pippa, and I'm going to share some of her story with you. She was a planned second pregnancy, and the older sibling was a toddler in daycare. Her mom was diagnosed with CMV at 21 weeks pregnant by amniocentesis. There was some discrepancies and things seen on ultrasound at her 20-week ultrasound. She received experimental treatment at the University of Minnesota during pregnancy. At the time, she didn't know if she was receiving the placebo or the actual treatment. Pippa was born with CMV in her blood, urine, and saliva. Her symptoms at birth included thrombocytopenia, intracranial calcifications, and she was on Valcyte, which is another version of the valganciclovir antiviral drug, twice daily for the 6-month period or 180 days. Her follow-ups included hearing, vision, early access, which is early intervention, the developmental clinic, infectious disease, PT, OT, speech language, and feeding therapy. Pippa's now 5, and she has polymicrogyra, developmental delay, intellectual disabilities, epilepsy. She's nonverbal. She has a feeding disorder, and she has bilateral hearing loss. This is another little boy, Ryder, and a little bit about his story. He was born in 2018, and he passed his hearing screening on the 3rd try. He had petechia, which is a rash, a skin rash that can be associated with CMV. Some people call it a blueberry muffin rash because it can be blue or purplish spots kind of all over the baby's skin, but he was not tested for CMV. At age 1, he was diagnosed with hearing loss, and they found white matter changes in his brain. His neurologist requested his dried blood spot be tested for CMV. And his mom shared that they only got their CMV diagnosis because they pushed and pushed and pushed to try to find a cause for his hearing loss. But because he wasn't diagnosed until after age 1, he missed out on possible antiviral treatments follow-up with his hearing, and even early intervention because they weren't plugged in to the system with a diagnosis. This map shows kind of the current state, most up to date of July of this year, of legislation about CMV in the United States. So while we mentioned more than 95% of CMV babies are not identified, several states do have mandated targeted screening. So if an infant fails their newborn hearing screen, then they are tested for CMV. And that is what Virginia's law requires. Minnesota is actually the first state in the United States that will be screening all babies at birth, regardless of their hearing status. That legislation passed and was signed by their governor, and they're still working on rolling out implementation. But it's very exciting to see that they will hopefully be able to capture that greater than 95% that are not currently being identified, and maybe some other states will hopefully follow. Some states that require education and targeted screening: Illinois, Iowa, Kentucky, Maine, New York, Pennsylvania, and Utah. Utah was actually the first state that had any sort of CMV legislation on the books. The National CMV Foundation has submitted a package for the RESP, which is the Recommended Uniform Screening Panel. And out of the congenital conditions that are included in the RESP, so those are metabolic and endocrine disorders, CMV is more common than all of those combined. So getting CMV recognized on the RESP would be a huge step in nationwide helping states get CMV screening and testing into their newborn panels. So we're in Virginia. This is Virginia's legislative journey for CMV. So in the session for 2019, House Bill 2026 was introduced. The bill received bipartisan support, and it passed on February 22nd, 2019. It's called the Newborn Screening Congenital Cytomegalovirus Bill, and it went into effect on September 1st, 2020. So what that means is that when a baby goes through their newborn hearing screening at a hospital or birthing center, and the baby does not pass, the baby is screened for CMV. And then from there, if the screening is positive, then they would be tested for an official diagnosis of CMV. Virginia currently screens for 35 different conditions at birth through the heel stick or blood spot. And that cost is around $138 per child to the state, and that's paid by the birthing center or hospital. It's not attributed directly to the family. In Virginia, every state is a little different, but in Virginia, dried blood spots are maintained for 6 months unless a blood spot comes back with an abnormal rating or an abnormal read. So if the blood spot identifies cystic fibrosis or any of the conditions of those 35, those blood spots are kept for 10 years. I know for me, when I gave birth to my children here in Virginia, we were also given like a dried blood spot card to take home and save. And it was explained to us, like if you were ever in a situation where your child unfortunately needed to be identified due to accident, injury, abduction, that dried blood spot could be used by a lab. But those dried blood spots are also ones that families can use for CMV testing or other congenital disorders that can't be tested for outside of that 21 days. But that also requires a family to maintain that card. This is Virginia's law as it is written. So if a newborn has failed their newborn hearing screening, that hospital or birthing center has to collect and submit a sample for CMV testing before the baby is discharged. If the newborn is under the care of a specialty level nursery like a NICU, the screening will be done when the baby is able, according to the protocols. So there are babies that are just not stable enough at birth for that to be the highest priority for them to do a hearing screening. And that the Virginia Department of Health shall develop and approve and publish informational materials for the general public, for healthcare providers, and women who may become pregnant, as well as expectant parents and parents of infants, regarding these things about CMV: incidence, transmission, diagnosis, birth defects, treatment, all of that, kind of with the tiny little caveat that parents can still refuse testing. So there are situations where parents say, no, I don't want a hearing screening, or even yes, I understand that my child failed their hearing screening, but I don't want CMV screening. Here are some of the educational materials that Virginia has developed to kind of meet that criteria of the law of providing educational materials. A lot about the prevention, basic knowledge about CMV. Also, Parents' Guide to Congenital Cytomegalovirus. So this is a great resource for families once they are identified, and it kind of outlines for them who are the specialists that they should be seeking out, what resources are available for them. This didn't exist when my son Owen was born. And I think if something like this was out there, we definitely would have felt less alone in our journey and would have felt like, oh, there's other people who've walked this road and I know what to do. I'm not reinventing the wheel or constantly asking, the questions to my providers. I have access to that information. So it's huge that Virginia has these now out there. Okay, questions. Do you guys have any questions?
Lisa, in the chat box, we had some questions here. So from Joan Bruner, can we get a copy of the PowerPoint? This is some great information. I had no idea how involved CMV was.
Yeah, I'd be happy to share this with you guys. I can share it with Irene, and maybe Irene can help me disseminate it to the people on the call.
Oh, that'd be great. I would love to do that. And from Rebecca Stickler, is there a one-pager or something to share with the family? Also, what is being done in Virginia to raise awareness of CMV among providers?
Yes. So these educational materials that I showed on here are available on the Department of Health's website under cytomegalovirus. And any of those can be downloaded, printed, emailed. They are also working to raise awareness among providers about CMV. So for a baby in Virginia, if they are screened for CMV and that screening comes back positive and then they are tested, their pediatrician is supposed to be their main point of contact. So there is an increase, hopefully, in awareness among our pediatrician population as they are our kind of main contact for families. But there is always providers that even we personally encounter as a family that, we will gently ask, do you know much about CMV? And if they say no, we'll say, can we explain a little bit about it to you as it pertains to our child? And, ask them, do you have questions? Do you want to talk about it more? And many of them have heard of it, but haven't necessarily had experience treating a child with CMV that they know of.
So I'm going to share one more chat, and then we're going to go to Nikki as she has her hands raised. Valerie Abbott said that targeted CMV screening of newborns who failed the newborn hearing screening began in September 2020. Woohoo, go Virginia. All right, Nikki, your turn.
So, oh my gosh, when you put the visual up of the awareness of, the example of Down syndrome versus CMV, I didn't realize how prevalent it was, and that it's comparable and probably more prevalent than the number of babies born with Down syndrome. But this is really powerful. And I started thinking about, why in the world do we not see this on the news? Like, and then Zika, when you put up the visuals of Zika, and what is it, 200 kids a year versus 6,000 to 8,000, I was like, holy cow, everyone was scared to death of Zika. Everybody I knew of that was pregnant with a child was petrified of getting bit by a mosquito during that time, and so there's just a part of me that's like, is the Department of Health in Virginia reaching out to news organizations and journalists to try to do some, highlighted news reports on this? I honestly haven't seen anything. I haven't seen it in my social media feed. So this really struck me as it's not fair, because there's these kids are really losing access to early intervention that can really prevent it from getting much worse. And I just don't understand why this has not been prioritized. It baffles me.
Yeah, that's one of the saddest parts. And diagnosis of congenital CMV is an automatic qualifier in Virginia for early intervention services. And so any child that actually has that and carries that diagnosis gets to qualify as soon as that referral is made, and then therefore gets access to that support, because we know that there's a lot of delays and motor disabilities, vestibular disabilities, things that come, hearing, language. We need that early intervention and support. And a lot of these families need those professionals in their lives, kind of being able to say, I don't hear your son using a lot of sounds. Have you guys wondered about his hearing? Let's try to refer you to get another hearing test. Or, we're not seeing a lot of progress towards that volitional movement. Let's try to get a PT involved in your case and see if we can get your baby moving a little bit more. It's baffling when the prevention measures seem so simple, why we are not translating that to higher education rate about this disease to families.
Like the cost factor, there's so many preventative, there's so many reasons why we should do this. So I just don't understand why it has not been prioritized. So I wonder if Department of Health has considered seriously reaching out to news organizations to see if some journalists would be interested in doing some sort of investigation on it, or and putting it on the news and getting it out there. That this is just insane to me.
Yeah, there's some states will have like highlighted stories here and there, with stuff with families. But you're right. I've never, not that I don't watch the news a ton now. News is kind of dark these days. But nonetheless, there is not a lot out there. But the Virginia Department of Health has an awareness campaign. There are some videos that they've been getting out there. Moderna has been very invested in raising awareness, obviously partly because they're working on their vaccine. But there is more information out there than there was even 2 years ago. Still not enough. We're making positive steps. Anyone else have any questions? I'm also happy to answer questions over email.